Okay, I want to welcome everyone today for a tasty lunchtime presentation. We're lucky to have some representatives from Children's Hospital of Philadelphia, Celiac Center with us today. Children's is affectionately known as CHOP, both in the Philadelphia area and beyond. And today we're going to be talking about a holistic approach to pediatric celiac disease management. And we're excited and lucky to have Lisa Fahey and Betsy Turner with us today. I'll tell you a little bit about the Celiac Center at CHOP, and then I'm going to have Lisa and then Betsy tell you a little bit about themselves. The Celiac Center at CHOP is one of the largest and most comprehensive of its kind in the United States. Every year, they support more than 3,000 children with celiac disease and their families from diagnosis to long-term disease management. They have a team of people that address celiac disease from every angle. And so from there, Lisa, why don't you tell us a little bit about yourself?
Sure. So my name is Lisa Fahey. So I'm the co-director of our Celiac Center at the Children's Hospital of Philadelphia. I don't have celiac disease myself, but my brother has celiac disease. So it's something that's been near and dear to my heart for many, many years. And several of my extended family members also do have celiac. I trained at New York Presbyterian Cornell, as well as Loyola University of Chicago, and then here at the Children's Hospital of Philadelphia for my fellowship. And I've been with the Celiac Center for about 5 years now. So I lead a team along with my partner, Dr. Arun Singh, that includes celiac dietitians, people who are true experts in the details of the gluten-free diet, as well as our GI psychologist, and Dr. Turner will introduce herself in just a minute, but she is one of our team members from the psychology standpoint. We have social workers on our team. We have nurse educators on our team. We really have a collaborative group that works together to take care of our kids with celiac disease. So Dr. Turner, do you want to introduce yourself?
Sure. My name is Betsy Turner, and I am one of the GI psychologists at CHOP. One of my favorite parts of my job is working alongside my teammates within the Celiac Center. I also lead a team of 8 psychologists at CHOP within GI, and many of our team has the opportunity also to meet with patients who have been diagnosed with celiac disease. I trained at UMass Amherst and also at Boston Children's Hospital before coming to CHOP a little over 12 years ago. And I've been fortunate to work with the celiac team and be part of some of the fun things with the Celiac Center, between gluten-free nights out. Believe it or not, we used to do that. It used to be down at the Wells Fargo Center. It was so much fun, and there were cooking demonstrations and support groups that we run, and recently Education Day. So we are very lucky to be part of the multidisciplinary team.
And I'm sure that some of our listeners, when they hear about all the things that you're doing, are excited, and maybe if they're too far away, a little bit envious. I'm not sure. It's like when you hear there's a great gluten-free bakery and it's in like Manitoba. But anyway, so I'll get started with the questions, because I know that's really why our audience was here. And the first one is, does the Celiac Center only treat children with celiac?
So that's a really good question. So in addition to treating celiac disease, we also do treat children who have non-celiac gluten sensitivity. We partner with our allergists, and we'll often see some kids who have wheat allergy as well. And then we also will commonly see siblings of children with celiac disease, either because they've had abnormal panels and they need a workup, or because they have normal panels and yet have GI symptoms, and we'll treat those symptoms as well as we follow them long-term to determine whether they're going to develop celiac disease in their lifetime or not. But I would say the majority of our practice is children with celiac disease or non-celiac gluten sensitivity.
Which makes A lot of sense. The next question is, how is and this is a topic that I think every parent of children who are diagnosed with celiac disease faces at some point, but how is the transition of celiac disease management from parent to child handled as the child gets old enough to be in charge?
So I have to say, I love the use of the word transition, because that's really what it is. And we like to think of that transition starting very early on, even when kids are younger, to start being able to read labels and really involving them in understanding what gluten is and cross-contamination. So very early on in the process, starting to look at labels. We often talk about field trips to the grocery store and looking at labels there, picking out foods, practicing at home or practicing with friends how to talk to someone about eating gluten-free, when talking about whether to bring a gluten-free food to a social gathering and how to handle those social gatherings, that they're part of that conversation, even early on, what they feel the most comfortable with. So when it comes to time that they're getting older, so we're thinking about teenage years, they're feeling more confident in doing these things. And so's the family, because they've watched them slowly be able to advocate a bit more. Other strategies have been, in thinking about restaurants, because I think we often think about handling on their own when they go out socially with friends, practicing that together. When you go out to a restaurant, or even right now when we're ordering takeout, being right there and listening in as parents are asking about gluten-free options, talking about cross-contamination and having cooking in different pots and pans, so that there's confidence on both sides. So it really is a transition that doesn't just happen when they're teenagers, but happens all along, that they're slowly taking a little bit more independence.
And Lisa, is there a medical transition that goes on as well?
So that's a great question. So there is, and it starts quite young, in the early teen years, where we start to discuss more and more with the patient, during the visit, but also at the end of the visit, about taking ownership of the recommendations that we will have made. So for example, we have an after visit summary that we provide our families at the end of our clinic visits, which is basically a paper which explains our recommendations. And when the children are quite young, we hand the paper to the parent and we review it side by side with the parent to make sure they understand everything. As the child gets older, we actually start handing that paper to the child, and we go through it with the child step by step, and the parent is, alongside the child listening, but to give the child a true sense of ownership about their medical care. And as they continue to grow, we encourage them to start, speaking with their parents if they want to reach out to us, via MyChap, for example, that they are sitting with the parent when the parent, will write the MyChap, or they themselves will write the MyChap with the parent alongside them to communicate whatever questions they have. And then, we talk about transition to adult medicine. In the early teen years, we bring up the subject just so children and parents aren't surprised at 18 when we start, discussing, okay, now it's time to start identifying an adult gastroenterologist for you that specializes in celiac disease. And we aim to make that transition typically somewhere between 18 and 19 years old. If the child is going to college, we'll typically follow them through the first year of college, because that's a big transition time for families and the child with celiac disease, the adolescent then with celiac, because we know that eating is different at college, where they're living is different at college, cross-contamination practices, in the kitchen, if they have a kitchen in their dorm, all of those are big changes for a person with celiac disease. So really getting them through that first year of college, and then we send them, to our adult colleagues, where we're in a position that they feel confident that they're going to succeed as they move on as an adult with celiac.
Right. And it's nice to see recognition that as a lifelong condition, that there is that movement, both in terms of lifestyle and in terms of medical treatment. So that's an encouraging thing. What are the main issues that psychologists at the center see in children with celiac disease?
So we often meet with families around the time of diagnosis to help with adjustment, think of creative ways together with looking up recipes, talking with schools, talking with friends, how to handle social gatherings. So often we're involved at the very beginning. We like to be when we can be. Other times where we might be consulted and we might meet with families would be times where it might be hard to adhere to the gluten-free diet. So to team up with our colleagues to talk about reasons why it's important and to identify any barriers that might be getting in the way to following the gluten-free diet. Other times we might get involved would be around the transition to adult care. We might be talking with teens and parents again about how to advocate. Dr. Fahey was providing some great strategies that we do with handing the after visit summary. We often are coaching kids and teenagers to come up with their own list of questions before the visit so that they are prepared, that they are more a part of the visit. So those are some of the times. Other times that we might become involved is if there's been cross-contamination and there's anxiety related to cross-contamination. Those are times that we might meet more frequently with families.
Mm-hmm. So one of the things that we notice with celiac disease patients overall is that follow-up care in adults is not that common. A lot of people report that they get diagnosed and they really don't get follow-up care. And both of you can take a turn at this. Do you think that this is also true for children, or do you think that the picture is different from children and that they do get more follow-up care? And if you have any thoughts on why that is.
So that's a really interesting question. And I think it is different for kids, at least in our center, and I think for many of the centers around the country. You know, at CHOP, we work really hard in our Celiac Center from the first new diagnosis celiac visit, being that they have been diagnosed with celiac, you know, they've gotten their scope and they're coming in to really understand what that means, you know, and we try to set the stage at that first visit so that they have an understanding that this is really a lifelong journey and they're going to be cared for by a clinician lifelong for their celiac disease. Our first new diagnosis celiac visit includes not only a medical visit with their clinician, with their, you know, doctor, and sometimes our nurse practitioner as well, but also with our celiac dietitian, as well as our nurse educator, who does a beautiful hour-long lecture along with our dietitian to really give them the nuts and bolts of not only the here and now, what they need to know as a new diagnosis celiac person, but the importance of follow-up care and the things that we screen for long-term. You know, we talk about the importance of monitoring growth over time. We talk about nutritional deficiencies that we screen for, vitamin D, iron, things of that nature. We talk about the importance of screening celiac panels and surveillance celiac panels rather over time to just give us a little bit of a sense of how we're doing from a celiac standpoint. And then, you know, as a gastroenterologist, we're assessing symptoms over time, the initial symptoms they presented with, as well as different GI symptoms over time that some kids will develop. Constipation, you know, some kids will develop non-GI symptoms like stress and anxiety, and I'll let Betsy talk a little bit about that too, but we want to assess that emotional health over time too, to make sure that we are treating the whole person, you know, not just treating the villi, which are the finger-like projections, which are blunted in someone's duodenum who has celiac disease at diagnosis. Betsy, what do you have to add?
Yeah, I would say that I definitely think our kids and families get follow-up and are great with follow-up. And I was thinking about my experiences that sometimes I might be referred a child or a teenager that I might meet for a period of time on a pretty frequent basis to address what's going on in that moment or what some of the stresses may be. And then often, thankfully, as things improve, we go to a frequency of when you come for your celiac team appointment, we meet. So that's often my opportunity for check-ins. So there may be some families that I only see twice a year as more of a check-in because they're generally doing well, but just a touch point of tips and tricks along the way can go far. So I do really feel like we do good follow-up, and I give a lot of credit to our team, but I also give credit to our families because they're on it and they realize that they get the full picture. They get to meet with lots of different providers when they come in. So, I mean, we're focused in pediatrics, but I do really feel like there's good follow-up.
Right. So since we're talking about follow-up, I just thought of a follow-up question, just a quick one. Do you ever, have you noticed that there's ever a point where there's a little reluctance on the part of the children to come in? Like, is it like most kids get to be 15, 16, and they're like, now they're resisting a little bit?
I would say in general, most of them are happy to come in and see us. And I would say like they really like, I think, coming to the Celiac Center. Occasionally we'll get a child who, a teen typically, who might be less compliant with their celiac diet. And in those situations, there are some times where the parent is very excited to be there to talk about the compliance and the importance of compliance, and the child might, you might have to break the ice a little bit with the teenager, to really open that discussion of the importance of long-term compliance with the gluten-free diet.
Right. So you guys are doing something right if people are, are looking forward to their visit, right? So, we do know, and I'm sorry, Betsy, did you want to add something?
I completely agree with Lisa.
Okay.
Yeah. I was just I agree. I think especially for the Celiac Center appointments, our families enjoy coming in. They get samples, or at least they used to get samples. It's typically a fun experience.
Well, that's good to hear. Now, we do know that, one of the concerns that parents have when they have a child with celiac disease is if they're following the gluten-free diet, but yet they still have symptoms. And so I'm wondering what you advise a child or his or her parents to do if symptoms continue.
Yeah, so I think that's a very interesting question. And I think the first thing that we'd say is make sure you see your clinician and dietitian for follow-up, because one, make sure, is this related to celiac or is it not related to celiac? And I think that's a really important thing to distinguish. Our celiac dietitians, for a child who we think is having ongoing symptoms because of possible either cross-contamination or frank gluten ingestion from a product that they don't realize has gluten in it, our dietitians will do something called a gluten detective visit, where they really do a deep dive into every single product the child is consuming, as well as things like lipstick and things on the face, truly everything that's a part of their world that can be, going into their mouth or near their mouth, to make sure that it's gluten-free. In addition to that, from a GI standpoint, when the child would come in, we would think about repeat labs. We'd want to do a complete abdominal exam to see whether there's a new factor that's contributing. Assessing for other reasons, if it's a GI symptom that they're having, we assess for things like constipation. Sometimes our kids come in over time and they actually have GI infection. They could have an entity called small bowel bacterial overgrowth, where they have an overgrowth of bacteria in the gut that can give them abdominal pain, bloating, other sorts of GI symptoms that could potentially mimic celiac disease. And then we think about things like lactose intolerance, as some of our kids have around diagnosis. But even if they're far from diagnosis, some people just develop lactose intolerance over time as they age. So we think about those things. Delayed gastric emptying is another entity where the stomach empties more slowly than normal, which can mimic some symptoms of celiac disease if a child has GI symptoms related to celiac. And so we think about all these other entities as, whether it's the celiac or whether it's another entity that's causing these symptoms. And I'd say the final one that we think about and we partner with our psychologists about is the idea of functional abdominal pain or irritable bowel syndrome. So an overfiring of nerves in the gut that can occur in some patients even once their duodenum that's part of the small intestine where there's damage in a newly diagnosed celiac person, even once that duodenum is healed, there are some people who still have an overfiring of nerves in the gut and have this functional abdominal pain. And we really try to get to the root cause of, how can we optimize function and really help them do as best they can in life. So Betsy, I'll turn it over to you.
Yeah, I agree with, we really partner together, and our team, our ultimate goal is to help kids, teenagers function. And what I mean by that is get back to the things they either need to do or they have to do. So sometimes we're talking about getting back to school or getting back to activities, social or sports related, and even when the symptoms are there. So we're really trying to coach and come up with strategies to help not have the symptoms get in the way as much. We know they're there. We'd love for them not to be there, but our ultimate goal is to teach kids and families to continue to do the things in their day, even when they're not feeling well. And in doing that, sometimes we're thinking about different ways to think about things, or we're developing coping thoughts to kind of help them coach themselves in a way to push forward. Sometimes we're doing relaxation strategies to help them feel more comfortable, even when the pain is there. And really, really focusing on successes of, I went to school, or I logged on to school, even though I really was feeling crummy. That's awesome. We need to celebrate that. So recognizing the successes. So we really are teaming up with our GI colleagues to, if we can find some relief of some of the symptoms through some of the relaxation strategies, bonus. But we're also attacking and looking at, can we reduce the stress that's created by ongoing symptoms? And can we get kids back?
And I think, so that takes us back to really that holistic approach that you have at the center. As scientists are looking closer and closer at celiac disease, more and more treatments are in the drug pipeline, and there is some discussion about including children in clinical trials. Now, clinical trials aren't always drug testing trials. They can be, or trials are not always drug testing trials, but the simple question is, what are your thoughts on including children in clinical trials?
So, in general, clinical trials are how we make advances in the field of medicine, right? And I think that it's really important to include children in that so that they are included in those opportunities, when a medicine is available, that they're allowed to have it. If a vaccine is available, that they're allowed to have it, because we know it's safe and effective. Usually the clinical trials tend to happen first in adults, and then the kids tend to be a few years behind that, and so that does provide, as a pediatric doctor, that provides us with some reassurance that, okay, it's been shown to be safe and effective in adults, and now we're going to see how it goes with our children. But I think that in general, as a clinician, we are very much supportive of clinical trials. Our patients and our families are often, interested. And that's one of the things that they ask us at follow-up visits. When are there going to be clinical trials that we as a celiac pediatric patient can enroll our child in? Because they too want to advance medicine and move, celiac management forward. And that's one of the things that we actually will often talk about at our very first meeting with the child. So when they have an abnormal celiac panel and they come in to see us before they've been scoped, it's one of the things we talk about when we're talking about the importance of getting a formal diagnosis of celiac disease with an upper endoscopy with biopsy, because many of the clinical trials, at least in adults, require that you have a formal diagnosis of celiac disease in the United States, which is a biopsy-proven celiac diagnosis. So we want to leave that door open for our kids in the future if they, either as older children or as adults, want to enroll in future clinical trials, that they have that opportunity.
And I don't know if you have any thoughts you want to share on that topic. In addition, Betsy?
I agree with everything Lisa has said, and I think that it really is a patient, family, and physician together decision.
Mm-hmm. Right. That makes total sense, doesn't it? So when you see, so of course, celiac disease has, a beginning point and then it keeps going forward. What do you see being the things, what are the things that you see that people are most concerned about right after a child is diagnosed, both the children and the parents? And I guess this would depend on their age, but just in general.
Yeah, I would say from a parent perspective, they probably ask the most questions about damage to the duodenum, because in that diagnosis visit, we're talking about this. We show them pictures of the scope report where they can see the duodenum itself. We talk about what we see under the microscope, where those finger-like projections, those villi are blunted or shortened in someone who has celiac disease. And so the parents will often want to know, is that permanent? Is the damage to the duodenum permanent, or is that something that's reversible, and will my child's intestine heal over time? And so, we feel very hopeful in these visits that we can share with them that the intestine will heal over time with a strict gluten-free diet. So I think from the parent perspective, they're focusing on the healing. From the child perspective, the most common question I get is this a permanent change in my diet? Is this temporary, do it for a few months and then I can go back to eating gluten, or is this lifelong? Especially our teens, because they have a very specific understanding of things that they like to eat, and they will sometimes be a little bit hesitant to change that. And then the final thing that a teen will ask me is about cheat days. I commonly get that question, is can I just have, this really good slice of pizza that has gluten in it once a month? Is that okay? And we do say, no cheat days, because we really want to promote intestinal healing completely. Betsy, do you have anything to add?
Yeah, I think from the child and teen perspective, sometimes if they're having symptoms, when will I feel better?
Mm-hmm.
How long will this take? And I completely agree with Lisa of how long do I have to do this?
Mm-hmm.
And sometimes you see the really great burst of I'm in it, I'm ready to change my diet, I'm going to feel better. And then it sort of dwindles off of I still have to do this. I still have to do this. So there's that factor as well. I think sometimes it's not as often as you might think, but sometimes is this contagious? Which usually very easily reassured, no, even though sometimes it runs in families, it's not contagious. How do I talk to friends? Talking with schools. Sometimes pretty early on, we're talking about educational plans like 504 plans and communicating with the schools. This year's been a little bit of a different year because so many kids are virtual. I would say that usually school comes up pretty quickly in the process of what do we do with 504 plans? Do we need a 504 plan? Is a health education plan enough? My school is great. Do we need to have something formal? And there's no perfect answer to those questions. It's really individual. But those are some of the common questions, thoughts, and feelings that come up initially for patients.
And it's interesting that, that period right after diagnosis, particularly if a child has been sick, can be, you can see so much improvement in their health and they can feel so much better. But then it does open up a box of so many things you don't know about. So you have two things going on at the same time. Both you're feeling better, and sometimes you see really dramatic improvement, and at the same time you're coping with this whole new world. So I'm sure that all this advice, is extremely helpful to parents and children as they're starting out. So there are the kids who are symptomatic, and that's how they're diagnosed, and they're the ones who you would expect to feel better on the gluten-free diet. But how do you work with children who are identified through screening and don't have any symptoms? For example, one of the children in the family or the parents is diagnosed, and now the whole family gets screened, and now the child who feels great gets diagnosed. So how do you work with those children Is the diagnosis harder? It says a multi-part question. Is the diagnosis harder? How is it harder? And how do they do on the gluten-free diet? So that's a lot to, to take in all at once. But
so I'll first address this question of, is the diagnosis harder for them? And I think in some of our teens, it is harder, where they watch, I can think of one patient where, he watched his sister have significant symptoms and then feel better once she went on a gluten-free diet. And then he was feeling great all along, and he got screened only because his sister had celiac disease, which is a new diagnosis. He was positive, had a glaringly abnormal celiac panel, got scoped, and suddenly his whole world changed. His, not only what he's eating at home, but eating with friends. His relationships with friends was something that was very important to him, and eating was, a cornerstone of what they did. They went out on a Friday night and went to restaurants together, and at diners, and suddenly he had to reframe his thinking, and that was really hard for him, and I think many other teens too. I think the younger kids in general, when they're the parents are still making all their meals, packing their lunches for school, those kids, it's much less of an issue that we see that the families will tell us about, because it's just their way of life, and it's their way of, they've seen their older sibling do it, and now it's their turn to just be a part of a gluten-free eating. We try to focus for the kids who are struggling, with this diagnosis and struggling with compliance, with focusing on really helping them understand that even though they're feeling well on the outside, that there is damage on the inside. And I think formally diagnosing with an endoscopy can be really helpful here for these teens. So we can tell them, yes, 100%, we see that there is damage. We can make this damage better, but it's really important, to make that change, going on a strict gluten-free diet in order to allow your body to heal. And then we talk about long-term consequences of uncontrolled celiac disease, with the teen, as well as with the parent. We talk about not reaching full growth potential, concerns about nutritional deficiencies, intestinal strictures, small bowel lymphoma, potential for other autoimmune disease. So all these things that we are concerned about if we have long-term non-compliance in a celiac patient. And so, typically once they have a good understanding of the reasons why it's important, typically then our teens will get on board and do a good job with their gluten-free diet. And then we have this subsection of the diabetics, right? So we have a lot of type 1 diabetes kids who develop celiac disease, and this is discovered as a part of routine screening in the blood work. And they do really well. They, I think, do particularly well because they already have a regimen. They already have a diet regimen. They're thinking about the foods that they're eating every day. And so this is just another layer on top of that. But this is, most of our diabetics will come back and tell us, this was much easier to accomplish than, the changes that I needed to make when I first developed diabetes and started treatment. Betsy, what do you have to add?
I would say that in many ways, yes, there is an added challenge of not having symptoms when you eat gluten and having celiac disease. It's especially when I'm thinking of some of the teenagers that I've worked with who will say, and I can think of one in particular who would say, it's hard for me not to eat it because I don't have symptoms. Like if I got symptoms, I wouldn't eat it, but I don't. And so this is another time where it's really helpful to partner with GI, because our role can be to talk through some of that frustration and sadness and the, at times, belief that I don't have celiac disease because I don't have symptoms, to really partner with GI and have an appointment, go over the scopes and say, this is why. We are not asking you to do this diet because we think that it would be fun for you to not eat something you enjoy. It's because we're thinking about your long-term health, and long-term is much harder, much harder. I mean, when we think about taking antibiotics, even if we're told to take them for 10 days straight, you know, the first few days are easy because we want to feel better. It's those last few, because we are already feeling better. We don't have the immediate feedback of if we don't. So for these kids, it's hard. So we've had success with the best intervention here, aside from a place to process some of the stress around it, is education. And education, I remember a teenager who wanted to see the scope, wanted to see all of it, because he was really came to a place of, I don't have it. I'm telling you, I don't have it. So it really, we need the education piece for them of why we're asking you to do this long-term, and the long-term harm that we really want to avoid.
Do most families that you see do first-degree relative testing as a matter of course?
Yep, most of them do. You know, that's part of our new diagnosis education visit, is that we share, you know, the importance of that, and that approximately 10% of patients who have celiac disease. So if you are a sibling or a first-degree relative of someone with celiac disease, you have about a 10% risk of developing it in your lifetime. And so typically that's something that, you know, the siblings, I would say, almost always get screened. At least one of the parents typically gets screened. Sometimes there's some, you know, resistance from the other parent, often the other parent who didn't attend the appointment, you know, saying that, oh, you know, I'm asymptomatic, so I couldn't have it, you know, but in general, our families are receptive.
Right. So thinking about the number of patients with celiac disease who you see at the center, and the way you have this very broad and holistic approach to treating them, which to me sounds very heavenly. What are some of the interesting insights that children with celiac disease have shared with providers at the center? So in other words, the kids come to you, they learn a lot, their families learn a lot. What are you learning from them in a sense?
Betsy, you want to start?
Sure. Lisa and I were talking about this earlier this week, is we have been so impressed by some of the fundraising and advocacy and information that our patients and families get involved in. I do think, you know, tips and tricks, sometimes my best tips and tricks come from families about experiences they've had with advocating with schools, or different great bagels that they've found that taste like great bagels. So sometimes I do pass along those tips and tricks, but I have to say that the families that we get the opportunity to work with, I can think of a 10-year-old who recently built his own celiac website as a school project, and you know, the family sent it to me and it was amazing. I mean, it had fun from the start. It had these great memes on there, were just wonderful. And the experience that the family shared with me about putting this together for him, it was, he presented it to his class, and this was the first time he presented to his class that he had celiac disease and what it was, and the class asked such thoughtful questions, and it was such a nice experience. And then the family found out that there happened to be another student at the school who had celiac disease, and the family is using his resource guide because he put in there tips and tricks for like what are the best restaurants in their area. So they use his website when they're ordering out. I mean, there's just been amazing projects. There's, I can think of students who've done, you know, their scouting projects related to celiac disease and education. We have the great opportunity to run monthly support groups, and part of the support groups are talking about life with celiac disease and tips and tricks, what's been hard, what strategies they've come up with, and just connections with one another. But they're also fun. I mean, we do bingo and we have cooking demonstrations. So, you know, I think what we've learned is how much people just run with what they have to do with changing their diet to manage this disease, and how they support each other and really reach out into the community in ways that we aren't, but they are. I mean, it's amazing. So it's just impressive to see, and then when they bring it back to us, it's great.
I agree. I mean, I think so many of our patients get such positive feeling of doing advocacy and outreach for celiac. You know, I can think of a family who has gone to Washington to advocate for children with celiac disease. We have another family who confidence for the children was something that was really important to them. So they got together with their with other local families and raised money to buy new dresses for kids with celiac disease to donate them to the center, so that other children who have a new diagnosis of celiac would have, you know, a new outfit and feel a little bit more confident.
Yeah.
You know, some of our kids volunteer at our annual Celiac Education Day because they really enjoy giving back to others who have celiac and really, you know, creating a partnership not only with our center, but with other kids with celiac. We have some kids that, you know, come back and say that they've identified another child either in their school or in their local community, you know, who has celiac, and that they've sort of been an unofficial mentor, you know, of how to navigate everyday life with celiac disease. So I really think this idea of advocacy and outreach that our children do and families do, and they can partner with us to do. You know, we had one family who said, we would love for, you know, the celiac team to be able to go into schools and educate the teachers and the nurses, you know, and at PTA meetings, the other parents, you know, about the importance of celiac awareness, you know, in the community. Things of that nature. So partnering with families, you know, to be able to provide resources to the community is something that's been really fortunate, and something that the kids will, you know, they really get excited about that, and the families do too.
And it's interesting because it takes me again back to this whole idea of a holistic approach, and also reminds me of something I can remember when my daughter was diagnosed. This was almost 30 years ago, thinking that I could draw a circle around our house for 20 miles and never find another child with celiac disease in it. Her pediatrician had a busy practice. She was the only child he had ever seen with celiac disease. So that connecting, you know, is of a value that you can never shortchange. So we do have a few questions that were sent to us in advance by some people who are tuning in. And the first one, we've been talking a lot about children. This one has more to do with babies, particularly those who are at risk. And it says, what is the best way to introduce gluten to babies who are starting solids? This would be at-risk children. When do you introduce it, and how often can you give them gluten? And then it has a second part. What signs should you watch out for when first introducing gluten to a child at risk for celiac disease?
So that's an interesting question. You know, most of the pediatric celiac centers around the country these days, you know, are recommending to introduce somewhere between 4 and 6 months old, just as you're introducing other solids, you know, when the child is developmentally appropriate, to start introducing the soft pureed foods. And then, you know, just as with other solids, you know, soft purees are a great place to start. Sometimes like the baby crackers, you know, or wafers will have gluten in them. So that's a nice way to slowly, you know, introduce gluten, you know, gradually into an infant's diet. And then watching out for signs like bloating, you know, signs of increased crying and concern for abdominal pain, diarrhea, vomiting. Those sorts of symptoms are things that you should certainly talk about with your child's pediatrician. Having said that, you know, guidance, you know, medicine changes over time, you know, so I would certainly recommend, you know, when you feel like it's time to introduce solids, that you have that candid conversation with your child's pediatrician to get the most updated guidance. You know, look at your pediatrician has probably read or has talked to a gastroenterologist who has read the most updated papers about the current recommendations on the subject. Because the amount of gluten sort of even to this day, varies a little bit depending on your institution as to, exactly how much each day you'd want to introduce. So it's something I'd really encourage them to loop back with the pediatrician as you approach the 4-month mark so that you feel prepared and ready to introduce gluten into the diet.
Right. Sounds like good advice. So another question that came from our community is, do you have any general advice for children and parents to deal with the mental, so this is an interesting component, the mental and physical effects of an accidental glutening incident?
Betsy, you want to take that first?
Well, I will happily take that first. I think an accidental glutening or exposure is scary for everyone, and I think some of the strategies is really a balance of having it be more of a learning experience of that, do we know how it happened, and that we got through it, and that we're okay. So it's taking the full circle of we want to avoid being so fearful of another exposure that we don't go back to the place where it occurred, or we don't go out to restaurants, or we don't order food. But we also want to use it as a learning experience to be able to avoid it happening again. So it really is a balance of, you got through it, we're learning from it, and we'll try to make changes next time. Because I have seen where it flips to so much anxiety about experiencing an exposure again, and trying to reduce the anxiety of why we want them back in the places where they were, and if we can figure out what the exposure was, even better. I think it's been the hardest when we don't identify what it was, because then it makes people very fearful. But learning that they get through it in a way, you get through it, but we don't want you to have to go through it, can be a helpful strategy. But it is a scary event when we're exposed to gluten. Naming it that it was scary, and we're going to do our very best to avoid it happening again, and continue to go out and doing things that we either need to do or want to do.
And then I think that's great advice. And from a physical perspective, if we have a child who has, let's say they start eating and then they recognize that, oh my gosh, this actually had gluten in it, obviously they want to stop eating that immediately, not finish the course, stop it immediately. If they're at school when this happens, and they know, or parents know, that they typically vomit when they're exposed to gluten, or they typically have severe belly pain or diarrhea, that if they are at school, going to the nurse's office is often, a good idea, both from a symptom monitoring standpoint, as well as there are some kids that don't want to, for obvious reasons, sit in class and suddenly vomit in front of their peers, so if they know that they're likely to get sick, we don't want to have that mental anxiety on top of it of fearing that upcoming symptom, so to go to the nurse's office, the nurse may or may not call the parents to pick up the child, if they are anticipating a significant reaction, over the next few hours. Same thing's true if they're out at a friend's house when it happens and they know that they typically have symptoms that they don't want to have in front of that peer, to call the parent, to have the parent come pick them up and try to make them as comfortable as possible as they're having the physical effects, which can range far and wide, right? Sometimes it's vomiting, sometimes it's abdominal pain, sometimes it's diarrhea, sometimes it's fatigue and headaches with no GI symptoms at all, but really trying to just help the child do symptomatic management, meaning get them through the episode in a safe fashion. If they have things like symptoms like vomiting and diarrhea, making sure that the parent is monitoring for dehydration, small frequent sips of fluids, so that they don't end up in the emergency department, which is the exception, certainly not the rule, but we don't want them to end up in the emergency department with needing IV fluids if we can absolutely avoid it by being home and focusing on hydration. And then thinking about repeat occurrences, right? I think what Betsy said was very important, where are they able to identify what the culprit was or not, you know, because if not, and this is happening on a repeat basis, you know, they really want to work closely with their clinician and their dietitian, you know, that specializes in celiac to figure out what it is they're eating, you know, that they're being exposed to that's causing them to have these reactions. You know, if your team is lucky enough to have GI psychologists to help, you know, with the stress and anxiety component that is sometimes associated, then that's key. You know, if your team, you know, you're, you know, somewhere far from CHOP and your team doesn't have a GI psychologist, you know, we do second opinions, you know, many second opinions every year for children who, you know, really want a comprehensive second look at what's going on, you know, and that's something that we offer both virtually and in person. So we do, you know, we have telehealth visits for families too. So I think just making sure that you're treating the whole person during this accidental gluten contamination, you know, is really important.
I think people sometimes think, what can I take? I don't know that there is anything that you can take.
Right. And so there, you know, there's not anything that we medically recommend that, you know, kids routinely take if they've accidentally consumed gluten. Having said that, if we have kids who are known to have severe vomiting, you know, where, you know, we're trying to prevent them ending up in the hospital, you know, there is some times where your provider may prescribe an anti-vomiting medication to sort of decrease the chance that you're going to get dehydrated. Now, having said that, that's a fine balance too, right? Because the vomiting itself is the way that the body's trying to expel the gluten, right? So ideally, you know, you let the body expel the gluten, but not to the point that you're going to get severely dehydrated. So I would say antiemetics or anti-vomit meds are, you know, sometimes used, and I would talk to your provider very specifically as to whether that would make sense for your child or not.
Right. So another person in our community asked, how can parents support the mental health of children with celiac disease, especially as they enter the preteen years?
So there isn't one way to do this. I think generally a first step is to listen. I mean, it sounds a little corny to say, but really listening and allowing the teen to speak about whatever's on their mind, and know that when you're listening, you don't have to have the answer because there may not be one. So really the listening in and of itself and having them feel heard can go a long way. If there is opportunities as you're listening to problem solve, after you listen, make some suggestions. If it's something about problem solving, that may be something that you can brainstorm together. Other times it may just be nice to feel that they're being heard. For our teens, I think that, you know, it is helpful that psychology is a part of the team. So we're there when there aren't anything behavioral health wise to necessarily be concerned about, or there are no risk, because we're checking in, see how things are going, and you know we're part of the team. So it's so nice that we're partnering early on. So when transitions come up in teenage years or other times, we can address them. We can identify changes, and if we're thinking about when might be times to look into seeing somebody in behavioral health, is really you're looking for other changes. Are there changes? Am I noticing that my teenager seems more depressed or down? And when we're thinking about depressed or down, we're thinking most of the day. Any changes in school, any changes in grades, changes in not feeling like doing things that they used to like to do. It's been tricky again. This year is so different that our kids are not able to do things that they usually like to do. So teasing apart, do they have the motivation to do it, or can they just not do it because it's not feasible? We can't be doing the social things. But looking for changes in appetite, changes in sleep, anxiety that gets in the way. I think it's normal during times of transition to feel nervous about starting high school or doing new things. So feeling nervous, feeling anxious in and of itself is not a bad thing. It just tells us we're doing something new. But when it prevents, or it really just has kids feeling like they're feeling stuck and they just can't do that thing, that's when it's time to reach out to someone like me, or somebody in your community. We are out there. We are, whether it's us, or we're happy to provide referrals if it's not us, because sometimes it's related to celiac disease or GI symptoms, and sometimes it's not. And there are providers out there. What's nice is that there's so much more recognition of the stresses of growing up, that there are supports out there. So we're one of those supports, but there are other supports out there. So my short answer was listen, and pay attention, but it's a lot more involved in that. And an open door policy of, I'm checking in, and anything you need to talk about, I'm here. And if we need to build a team together, we will. So long answer, and there isn't an easy one for that one.
And if I have to add, I would just like to say, I think that conversation can start with the provider that's seeing the child regularly, because I think it's often a barrier to get in the first time, for the child to feel like they're comfortable seeing a psychologist, So if that's the pediatrician, or if that's the pediatric gastroenterologist, for the parent to bring up the conversation, either at the time of the visit, or even send a message ahead of time, saying, this is something I'm hoping that you'll bring up today. That's really key, because then as a clinician, I can be a neutral party, sort of introducing what I'm seeing, and sort of suggesting something that might be really helpful, but might be better received from a clinician than coming from mom or dad.
Yeah. Especially to a teenager.
Yeah, and what's been nice about our team is sometimes Lisa might be introducing the idea to the family, and there are times where I'm in the consult room next door that I can pop in and say hi. I'm not going to do a full sit down, but they at least can put a face to a name of this person that they want to introduce. So that's one of the nicer things about being on a, as you described it, more holistic team, where we can tag each other in.
Right. Yeah, and I keep going back to this, but I do like the whole concept of holistic, and I think that between the two of you, you've described it so well, and I think it includes a lot of good advice for parents who are able to come to your center, and the ones who can't, things for them to think about and approaches that they can use. We're almost out of time, so first I want to say thank you to both of you. It's been a great and enjoyable hour, and it went by so fast.
Yes, it did. Yeah, thank you. This has been a wonderful talk.
Yeah. So I don't know, we have 3 minutes. If there's anything either of you want to say in closing.
No, I would say talk to your clinician, if you talk closely to them about what is the best group of people, to help you with your child's journey. If you're fortunate enough to live near a celiac center, go to that celiac center. If you live far away, you can have a primary gastroenterologist manage your care, but still seek, advice from time to time from second opinion centers that are, maybe a little bit further away, but worth the trip or worth the telehealth communication, because we really want to treat the whole person with celiac and create this nice lifelong path that they, in the future, we hope that compliance will be better for adults with celiac because they've, established this really nice relationship when they were a child with their medical team. Betsy, anything?
I really just want to say thank you for including our whole or two people on our team to represent that we are multidisciplinary, and that we really do work together, even though we might be targeting different things. It really is a team approach. So I really thank you for inviting us today.
And
yes,
thank you so much for joining us and for sharing all of the knowledge that you have. We very much appreciate it.
Absolutely. Thanks for having us.
Thank you.
Bye-bye.
Bye-bye.
Bye.